What does informed consent for Concerta, otherwise known as methylphenidate, the long-acting version, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process, as I would with one of my patients. So today we're talking about Concerta, and Concerta, like I said, is a long-acting version of methylphenidate. And methylphenidate is one of our two stimulant types. So we have amphetamines, which is things like Adderall and Vyvanse, and then we have methylphenidate, which is things like Concerta, Ritalin. So due to its mechanism of action, the methylphenidates are a little bit less powerful than the amphetamines. And so for this reason, we usually think of these as being first line for use in children, and then the amphetamines first line in adults. But this can totally vary. Some adults benefit significantly from Concerta, and some children benefit significantly from amphetamines. So this is not a hard and fast rule. Concerta is FDA approved for the treatment of ADHD in both children and adults, as well as second line for treatment of narcolepsy. There are certainly off-label uses for Concerta as well, including behavioral issues in kids like intermittent explosive disorder and disruptive mood dysregulation disorder. Sometimes it's also used for treatment refractory depression, as well as cancer-related fatigue. Additionally, it can be used for cognitive enhancement, as well as apathy in those who have dementia. Side effects are going to be essentially the same as can happen with any stimulant. So this includes things like upset stomach. Sometimes it helps to take it with food, palpitations or rapid heart rate. If someone has a family history of sudden cardiac death, then they're going to need a cardiac evaluation to make sure it's safe. Or if someone has a significant cardiac history or they're having palpitations, it's going to be important to involve their primary care doctor or cardiologist to make sure that their heart is beating well and that there aren't any concerns with this medication. It can also cause things like decrease in appetite, insomnia, irritability or agitation, worsening anxiety, dry mouth, dizziness, increased sweating. It can have potentially negative psychiatric effects. So in addition to the anxiety and agitation, for people who have a history of bipolar disorder or are otherwise vulnerable, it can sometimes trigger mania, sometimes even psychotic symptoms like paranoia and hallucinations. Additionally, this is a controlled substance and there is abuse potential. So there may be some increased risk in those who have a history of substance use issues because combining this medication with other substances can lead to really dangerous situations. So in general, I do use stimulants with caution in these populations if there's active ongoing substance use. There's also a risk of priapism, which is a sustained erection, and this can be a medical emergency. It does lower the seizure threshold, and it can also make tics worse. And long-term use in younger children can lead to growth suppression. The nice thing about stimulants is that you can take them as needed. You don't have to take them every day. And so the less you take them, the less they're going to affect you long-term. And getting off of them is not nearly as challenging as something like an antidepressant. There can be a pretty self-limited withdrawal period. Usually that's over within 48 to 72 hours. And withdrawal usually looks like the opposite of the effect of the drug. So feeling drowsy, feeling tired, having brain fog, increased appetite, sleeping a lot, etc. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because they may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I'll see you in the next one.